Let's talk about the ligaments on the outside of the knee, the collateral ligaments. How strong are they? How good are they? How easy are they to damage?
Yeah, absolutely. Very, very important ligaments to having a healthy, balanced knee. The two ones we think of are the medial and the lateral, or sometimes we'll abbreviate them MCL and LCL. And these are very thick, dense bands of tissue, very, very strong. But unfortunately, with injuries and falls, they can be injured and cause significant debility for the patient. The medial collateral is definitely damaged more and is more likely to require some kind of surgical fixation. Many patients can be treated with bracing and without surgery, but in young patients and athletes, sometimes we have to go in and surgically repair those ligaments.
So if you've got a fibrous strand that's really strong, and do you stretch it? Do you tear it? What happens with injury?
Exactly, all the above. It starts out kind of small and you can kind of stretch it, and the ligaments can stretch just a little bit, but they have their breaking point. And once they hit that point, they generally kind of tear, and patients will classically say, I felt or I heard a pop. And you know then when you hear that, something's probably happened.
So when you go in and fix this fibrous strand, you tie it back together, support it, put a new one in, what do you do?
It's a little bit of both. It kind of depends where it was injured and just the setting. So sometimes we can do a direct repair or a primary repair where we kind of sew it back together or reattach it to the bone. Other times we just completely reconstruct it or replace it with a different ligament or tissue from the patient or even from a cadaver sometimes.
Is rehabilitation of a ligament, the medial collateral, the MCL, is the rehabilitation long time, short time, 6 months, 6 weeks, 6 years?
Not quite 6 years, thankfully. But ligaments probably take the longest part of our body to heal. They're very slow to heal. And so it's easily going to be 3 or 4 months before it really builds back strength. So patients are going to have braces and be restricted in their activity.
So we've got the collateral ligaments on the outside of the knee. I guess it keeps it from doing this too much.
Exactly.
On the inside of the knee, we hear doctors talking about anterior cruciate ligament and posterior cruciate. Tell me what those are, how easily they're damaged, and what do you do to repair them?
Yeah, absolutely. So those two ligaments are in the inside of the knee, and they prevent the knee from moving forward or back. And so the name of the ligament kind of tells you what it prevents happening. And so that's really common in athletes and also in car crashes. Again, really strong, tense ligaments that should, with minor trauma, last us our whole lives, but with high energy falls or accidents, these can definitely be torn. And most of the time, those have to be reconstructed. We don't generally repair those, but sometimes patients can do fine without them in select circumstances.